The Life Coaching Toolbox Podcast is brought to you by Joeel and Natalie Rivera of Transformation Academy. In this episode, Joeel talks about life coaching versus therapy. This episode is one of 6 episodes in a series called Life Coaching 101.
So now I want to go over an important topic, which is life coaching versus therapy. And I want to keep in mind that life coaching is an unregulated industry. So nowhere in the world that we have found yet are there any laws or regulation of life coaching. Therefore, anyone can be a life coach. No training or degree or license is required. However, it is important to understand that coaching is not and should not be the same as therapy. So I want you to keep in mind that terminology really matters. The first thing we're going to address is the use of terminology in the life coaching and therapy field. See, in some countries, anyone can call themselves a counselor, a psychotherapist, or even a psychologist. However, in most countries, this is not the case, including the United States, where Transformation Academy is based out of. There are clear distinctions, and misuse of these terms can result in legal consequences that, in reality, you probably want to avoid. So at the highest level is a psychologist, which has a PhD in clinical training. Then there are psychotherapists, therapists, licensed mental health therapists, and licensed clinical social workers, all of which require a master's degree at minimum, as well as clinical training. On the other hand, the word counselor is often used to replace therapists. However, it's also used to refer to non-degree fields, even like a camp counselor. So this word is a gray area. However, we do not recommend that you use this word counselor because of the possibility of confusing a possible client and getting mixed up, because some people might think that you're talking about therapy. Also, to add more confusion, there are related fields that are called what they do therapy, even though it's a certificate program, not a degree, and it's also not a regulated field. For example, hypnotherapy goes deep into the unconscious mind and is used for many things, whether it's smoking cessation, anxiety, depression, phobias, and many more things, whether it's weight loss. Yet it's an unregulated industry with no degree or license required. However, there are regulations in place in some states and countries, and you maybe have consequences for using it in a therapy setting or sense. If you're not a licensed therapist, in other words, using it to treat mental health issues, a big no-no, because you might get yourself in trouble. Another field that's surprising, not regulated, is the drug treatment centers. So yeah, if you send a loved one to a rehab facility, there is no regulation body that accredits them legally. So they can say that they're doing this therapeutic thing, but they're not anything legal holding them accountable. So even in countries that don't regulate any of the things above mentioned fields, it is still unethical and professional to use appropriate terms and referring to what you do and receive appropriate training, even if it's technically on the honor system. So appropriate use of the therapeutic tools in life coaching. Now this is an important area. So life coaches often use therapeutic tools such as CBT or cognitive behavioral therapy techniques, therapeutic arts, neurolinguistic programming, hypnosis, and other psychological techniques with clients. See, the word therapeutic means that it benefits the body or mind and increases well-being. Using these tools is helpful as a coach. However, it is not the same as conducting therapy like a therapist. So therefore, I want to just go over the boundaries between coaching and therapy. So a life coach can use therapeutic and psychological tools to help people. So they may help people change their thinking, increase their emotional well-being, change limiting belief systems or reframe things from their past, set and achieving goals, make life changes, increase motivation, learn new skills, and even change your identity to a certain degree. So in general, life coaches are present and future focused. Life coaches help their clients explore their past only as a means of understanding their current life experience and belief systems, but they focus on how they can make their future better. Their primary goal is to help a client look at where they are, where they want to be, and how to really just get from point A to point B. See, a therapist may also help clients with these areas of their life, but they also help their patients treat mental illness or clinical anxiety or depression. heal past trauma, cope with traumatic loss, cope with abuse, treat addiction or substance abuse, or cope with relationship turmoil or violence. So as you can see, there's a big difference. So in general, therapists are past and present focused. While therapists may work with clients to set goals and make changes, primarily clients come to them seeking assistance with healing trauma, overcoming abuse, treating addiction, or really treating mental illness that's impacting their daily life. So because therapists have a specialized graduate degree, clinical training, they have an extensive foundation and knowledge about the mind, biology, human behavior, and they're qualified to help clients in these sensitive areas. And more importantly, they're properly trained on how to handle the volatile nature of these situations. Because when you bring up past trauma, there may be volatile situations that you're bringing up. So you want to have the tools in place to be able to deal with those things. So I also want to talk about working with clients who also need therapy. So sometimes when coaching a client, an unexpected deep trauma can surface, where it can become apparent that this person is dealing with deeper mental health issues that you're unqualified to help them with and that you shouldn't be helping them with. In this case, especially if the person expresses the possibility of harming themselves or others, it is your moral and legal obligation to refer this person to work with properly trained, licensed mental health professional. Failure to do this can lead to legal liability. And think about it, you don't want somebody to harm themselves, so you don't want to create harm to them or harm someone else because you didn't refer them out to the right person. This is the best thing you could do to help them. You can continue to work with them as a coach if they seek the treatment that they need. However, it's not good for you or the client to continue to work for them if they're not being properly treated for those other issues. So you might be wondering, how can you tell if a person has mental illness or trauma that would really require therapy? So I'll give you a couple examples. Anxiety and depression. So working with people who experience anxiety, sadness, or mild depression, it's okay because those are all normal human experience. We might all feel anxious at some times, whether we got to give a presentation or something like that. However, the following high-level manifestation of anxiety and depressions are signal that people need help that a life coach is not qualified to provide. So incapacitation or the inability to really function on a daily life. Panic attacks that cause harm or require hospitalization, or suicide thoughts, history of those tendencies as well. The other part is mental illness. We do not recommend life coaches intentionally work with clients who have been diagnosed with mental illness or personality disorders, such as being a psychopath, sociopath, borderline personality disorder, obsessive compulsive disorder, multiple personality disorder, bipolar disorder, PTSD, etc., etc. However, I'm not trying to tell you that life coaches cannot coach people who fall under those categories, as long as the person's also receiving adequate treatment. In these situations, the life coach are not addressing the underlying illness or the issues that are deep that they have to deal with. Instead, they're supporting the person to make life changes, set goals, and practice new way of thinking and new skills. So here are signs that your client may have mental illness or may not even be coachable. So incoherent or illogical thinking patterns, inconsistent stories, beliefs or common flip-flopping or opinions, regular poor decision making, even after discussion in details the right decisions, inappropriate attachment to the coach, neediness, or even romantic advances, irresponsibilities such as repeatedly missing appointments or not following through on agreed upon action steps, or explosive or hostile reactions to insights or recommendations made by the coaches. So they might not have mental illness, but they might not be coachable either. So remember, it's always up to you to terminate the relationship with any client that's not coachable, not compatible, or needs help that you not feel comfortable providing. As a coach, we're here to empower people to live a better life, not heal them or cure their illness. And we definitely do not want to do them harm. So just like the oath for medical professionals, we must always commit to the core ethical standard in the industry, which is first to do no harm.
Visit transformationacademy.com/toolbox to download free life coaching worksheets that go with the activities discussed in this podcast, plus other resources for creating a thriving life coaching business.